This training is tailor-made for doctors working in the intensive care units, step-down units, and the emergency department.
Their insistence on doing it on your own very fruitful.
I feel very lucky to be under their guidance.
This training is tailor-made for doctors working in the intensive care units, step-down units, and the emergency department. It provides a comprehensive training on evidence-based practices, emerging trends, and improving patient outcomes and quality of care in intensive care settings. The content that it covers spans across basic life support, different oxygenation techniques, airway management techniques, how to manage a patient on a ventilator, procedures like intubation using laryngoscopy are taught in our trainings.
We have covered a lot of important topics, starting from the basics of ventilation, ECG, and then various poisoning. Then we did the laryngoscopy, and then ultimately there were a central line hands-on demonstration were done, and each of the participants they did by themselves under the guidance. I feel very lucky to be under their guidance.
I am very happy and satisfied with the quality of the teachers, faculties here. Their interactive sessions, involvement of all the parties, their hands-on training for doing all the procedures, and their insistence on doing it on your own very fruitful. And I'm sure after these 2 days there will be changes in my day-to-day practice.